Hello everyone, today's topic is dysentery. So, what definition says about dysentery? It's a kind of diarrhea where abdominal cramp, tinnitus, and passage of mucus present in stool. What tinnitus refers? Tinnitus refers to cramping of rectal pain. When tinnitus gives you a feeling that you need to have a bowel movement, even you have had once. So, and now, what are the types of dysentery? It's basically two types. One is bacillary and another is Amavic dysentery. Now let's talk about Bacilli Dysentery. It is infected by the Selaginella species. It may be dysenterica, it may be flexneri or solanae. Different types of pathogens are present which causes dysentery. Now, what is the mode of transfer? It is a fecal-oral route where the poor hygiene is present, there may be chances of dysentery to happen, and it is commonly transferred or spread through the houseflies. Now let's move on to the pathology. Here the lesions are found in the colon regions. Superficial transfer ulceration is seen in the bowel walls, and some lymphoid tissues are also infected. Incubation period is 1 to 7 days. Incubation period means the time period for which the pathogen reside in our body or at that the particular site. So here the incubation period is 1 to 7 days. Now let's move on to clinical features. The onset is acute. Sometimes in the beginning, the loose stool is seen, and after a period, blood with mucus and pus is also seen in the stool. Here, tinnitus is as usual, colic pains are present, and oliguria, mouth dryness, urea is found, and very high fever also occurs. In severe cases, there may be headache, meningitis, backache, muscle pain, and sometimes leads to the coma or convulsions are also present. Now let's move on. Now here we will read about what are the complications. Complications may be divided into two. Means one is intestinal complications and another is systematic complications. Now in intestinal complications, hemorrhage, perforation, stenosis are common, and sometimes prolapse of rectums is also seen, and toxic dilation of colon is also seen. In systematic complication, septicemia, hyponatremia, hypoglycemia, malnutrition are present. Let's discuss about Amavic dysentery. It caused by ant amoeba histolytica. It is more prevalent in the tropical countries, and it affects mainly the large intestine. How it occurs? It occurs due to ingestion of the cyst form of the parasite. The cyst form is dissolved in the small intestine, and it from travels from there to the large intestine. Now, from the large intestine, it travels via the mucosa layer of the epithelium, and it reaches the submucosa and produces a flat-shaped ulcer. At the beginning, early lesions are found in the intestinal regions, where a small elevated areas are found in the mucosal surface, and in the later or in the advanced stages, these flat-shaped ulcers have their narrow neck and broad bases are seen. They are mostly found in the rectum and the cesium region. In the later period of time, they shows a chronic inflammations, edema, and vascular congestions are found in the area where the ulcers are formed. Now here are some slides which shows how these ulcers look like. So now we talk about types of dysentery. Earlier we have discussed about the types of dysentery in respect to the pathogen, means bacillary and amabic. Now here we will discuss about the acute and chronic stages of dysentery. So here talking about the acute amabic dysentery. Here the loose stools are seen with blood, pus and mucus, and tinnitus occurs 5 to 10 times in 24 hours, or it may be more than this. Fever is usually absent, or if present then it is very low grade. Loss of appetite and dripping pain in the abdominal region, pelvic region and the umbilicus is seen. Now in the chronic Amavic dysentery, constipation is seen alternating with dysentery. Now flatulence, acidity, heartburn, duodenal ulcers. So temperature is of low grade and abdominal pain is seen in the abdominal region and also around the umbilicus region. Now let's talk about the complications. So here we can see that amabic liver abscess, amabic hepatitis, perforation, hemorrhage, and sometimes formation of the amoeba, which is a tumor-like masses. These can be the complications. Now move on to the investigation process. For investigation, stool for RE and ME means routine examination and microscopical examination. Stool for the OPC and the occult blood, stool culture, examination for blood, that is routine examination, and colonoscopy, USG. These are some investigation which can help us to know pathogenicity.